Dr. Deb Schreibman here. What's healthy? We are going to start out today and talk about nutritional counseling and how it is a really super cost-effective way of investing in your health. And I'm a huge proponent of nutritional counseling. I probably spend about 75% of my time doing nutritional counseling with my patients because it is such an important part of health and wellness and staying healthy, whether we're talking about chiropractic care, massage therapy, acupuncture, cupping, functional medicine, whatever it is, nutritional counseling is such a huge part of it. Some of us call us nutritional coaches, whatever you want to call it. It's super important. So I did want to take a couple minutes to talk to you about that today. And all kinds of different conditions can be helped with nutritional counseling. From little things, and they're not really little things, but headaches, right on up to autoimmune diseases, diabetes, insomnia, weight gain, all kinds of different things we can handle when we talk about nutritional counseling. My suggestion is that you find somebody who is up to date and really, really educated about the thing that is bothering you the most. So if you're interested in nutritional counseling, make sure you call the person up and have a good discussion with them, or call the doctor, a doctor like me, up and ask the right questions. Oftentimes we will give you all free 15-minute consultations so that we can make sure that what you are dealing with is something that we can help you with. So nutritional counseling is fantastic. I definitely recommend it for everybody. There's all kinds of different ways people practice when we talk about nutritional counseling. What you can expect in my office when you come in for that is you can expect to come in, you're going to sit down, we're going to give you a tour of our office so you can see all of the incredible things that we have to offer you. And then I'm going to bring you upstairs to my private office. And if you can't make it upstairs, don't worry about it. I have another office downstairs for those of you who have issues with stairs. And we will sit down, we will talk about everything that you've gone through. We'll talk about your goals, the things that are important to you for your health, and then we'll prioritize those things, and we will then come up with a game plan so we can fix the things that are really bothering you, so that we can work on your health concerns, and we can do it in a natural way. I know a lot of my patients come to me for nutritional counseling because they go to their doctor, they get diagnosed with hypothyroid, hyperthyroid, Hashimoto's, diabetes, all kinds of different things, and then they don't know what to do because their doctors say, hey, go home. You'll be better if you work out, if you lose weight, and you know what that's all about, right? New Year's Day, everybody goes and works out for about a week, and they join the gym or they take a yoga class, and you go join something like Weight Watchers or Jenny Craig or Nutrisystem, things like that. You do it, you might lose the weight, you might not even lose the weight, it might last a week. What I'm talking about with nutritional counseling is not diets. It's lifestyle changes. It's the things that you can do so that you pour a good, solid foundation that doesn't have cracks in it. So when you build your home of health, which is your body, we fix it, we renovate it, and then you're healthy. I got a question coming in from Miranda. Miranda asks, while doing nutritional counseling, will I have to stop eating everything I love? God, Miranda, a good question. And you know what? It depends on what you love. No, that is not the point of nutritional counseling. Nutritional counseling is to give you the information, to give you the education so you can make really good choices. And when you have the information and when you have the education, then you will make lifestyle changes. And you know what I tell my patients? The time to have the junk food and the stuff that some of you really love, like ring dings and ding dongs and Twinkies and those kinds of things, is on special occasions, maybe a birthday, maybe an anniversary, a vacation. And if you're living healthy the rest of the time, then when you do that, your body can tolerate it and detox it out, and you do super fine. So that's actually a really good question, Miranda. No, we typically do not make you give up everything that you love. And make sure that if there is something that you do love, you talk to your counselor about that, because if someone says, hey, you have to give this up, and you really have a big issue with it, discuss it. And your counselor will give you reasons why. You may say, yeah, okay, great, I get it. Oftentimes when we ask somebody to give something up, it's only short term. So great question. Make sure you ask more questions when you ask that question. And we're going to go ahead and move on. We're going to start talking about some exercise and types of exercise. And is exercise good for you or is it bad for you? So Is it good for you or bad for you? That's a great question. And you know what? The answer is it could be either. If you think that exercise is good for you, and most of the time it is, it can help with back pain, it can help with neck pain, it can help with all kinds of different things. You have to remember that you have to do it the right way. So I have patients come into my office oftentimes and they're sick, they have Hashimoto's, they have type 2 diabetes, they might just be overweight and they haven't been exercising. So is exercise good for them? Yes, but is all exercise created equal? No. In fact, I had a patient that came in this morning, and when I first met her, she had done no exercise at all. She was super, super overweight. We got a bunch of the weight off of her and we slowly introduced exercise back into her life. And for her, it meant gentle stretching in the beginning. It meant things like yoga, the restorative type exercise before we went into the hardcore exercise. And there's all kinds of different exercises that you can do. There's Pilates, there is cardiovascular stuff, right? So you either run outside, you can go to the gym, run on a treadmill. I don't know if you want to go to the gym right now, but if you are going to go to the gym right now, because I guess gyms opened up recently, be careful. But weights, weight training, interval training, CrossFit, there's a whole bunch of different types of exercise that you can do. And it's really important that if you do have a health coach or a nutritional coach, talk to them about it. Your chiropractor, somebody like me, your functional medicine practitioner, talk to one of us about it, because we can help you figure out where to start so that you don't injure yourself. Now, when you are hurting, is exercise good? Yes, sometimes it can be, because it's about strengthening that core. And that's what we talk about oftentimes when we have low back pain and sciatica, the pain that's running down the leg, is getting that core strong. Maybe getting some of the weight off so it takes some of the pressure off of those joints so we can keep you healthier longer and feeling better longer. And I got a question from Patricia. Patricia says, I like to swim, but is that good or bad when it comes to keeping my back pain away? You know, swimming is actually a fantastic form of exercise because it is very low impact. There is very little jolting and pressure on those joints. So if you are having pain, whether it's back pain or neck pain, even joint pain, it's a really great way to exercise without hurting more. So yeah, do it. Swimming is fantastic. Unless there's some reason that your doctor told you not to swim, I think it's a great way to get started and then to keep going, because swimming is not that easy, folks. So it's something, you know, that you can really start with gently. Maybe use a kickboard. I don't know, maybe use those little swimmies. You could also use something like this. I brought some stuff for you today. This is called TheraBand, and this is another way to exercise. So if you're at home and you're not going to the gym, you can buy some of this stuff online, and it's resistive. It's great for resistance. So what I do is I usually tie it on a doorknob. You could tie it on your seat, and then you can do your exercises using some TheraBand. You could also get some of these teeny weeny little hand weights, and I joke about it, but you know what? These little 3-pound guys are great to start with. Start small, get big. So I hope that helps. Swimming is fantastic. You should go for it. Go swimming. Swim as much as you can. Go to the beach and go swimming. That's what I like to do. So yes, exercise is fantastic for you, and I hope this is some great information. If you have any more information or if you have any more questions about this stuff, don't feel bad about reaching out to me. I'm happy to answer those questions for you. I also wanted to talk about cupping today. Cupping is it's a form of alternative medicine. It started in China, and you know, when you look up the information about cupping, you get a lot of mixed information. It's very vague information, because I think they're still trying to really figure out how it works. But it's really a pretty cool therapy that you can add, or a pretty cool alternative medicine technique that you can add to your tool belt, because you know, sometimes cupping it makes the difference between a chiropractic adjustment working and a chiropractic adjustment working and really holding for a long time. It's pretty interesting how it's done. I brought one of our cups. I don't do the cupping in my office. My acupuncturist does it and my massage therapist does it, but this is what a cup would look like. And there's a couple of different, actually there's more than a couple of different techniques in cupping, but I'm going to talk a little bit about dry cupping and a little bit about wet cupping. This right here would be the cup that we would use, and there are different types of cups too. This is just a glass one. And what we do is we take maybe a cotton ball or some other substance, maybe even an herb, light it on fire, and we put it into this cup. What happens is the fire pulls the oxygen out, and then when it's applied to the skin, it creates a vacuum. It creates a suction right in that skin. And then the suction sucks the skin up. So it's really kind of funny looking. You can see skin actually sucked up into there. And then it will sit for maybe 3 or 4 minutes. A typical session would be between 5 or 6 cups at once. And typically, I don't think I've ever seen any more than 7 cups. I mean, it could be possible, but I think at the most it would be about 7 cups. And we do that and we leave it for about 3 minutes or so. Now, in dry cupping, that would be basically the whole therapy, right? They would then remove the cup. You may see some discoloration of the skin. That's just like a bruise. And how we think it works is it's pulling the blood up. And what is blood? It's got white blood cells, which is healing, right? Then there's wet cupping. Wet cupping is pretty interesting. What they do is they do the dry cupping first, and then they might go in with a little scalpel. They might poke a little hole, cut a little slit in the skin, really doesn't hurt, and then they do cupping again and suck that blood right out for you. So those are 2 of the techniques, 2 of the major techniques and ways that we do cupping. I did have a question that came in. This is from Brandy. She says, I suffer from acne. I heard that cupping can help me. Is this true? You know, great question. And yes, it is true. And, you know, again, we don't quite know how it works, but they would do cupping to the area of the skin that has the acne. And then I guess the goal would be really to bring that, quote, bruise, which is healing. So give it a try. What do you have to lose? You really have nothing to lose when it comes to something like that. So cupping is pretty interesting. Can it be a little bit sore when you do it? You can feel a little bit of soreness when you do it. I know it looks way, way worse than it feels. I've had it done myself. I know that a lot of athletes do it, so it's great for people who are exercising. It's great for back pain, for neck pain. Just make sure that you go to somebody that is qualified and has done this a lot so that you get somebody that knows what they're doing. So great questions. I think this is a really incredible technique, and I think that more and more as we move along, the research studies are going to show that it's going to be really an incredible addition to your healthcare. So try it out. Really, you have nothing to lose. Okay. If you want to email me, please email me at feelbetterhere@lakepointwellnesscenter.com, or you can go to our website at feelbetterhere.com, or you can give us a call at 770-974-5215. Until next time, love and light, health and happiness. Bye-bye.